So I want to welcome everyone. My name is Dr. Elena Rios. I'm President and CEO of the National Hispanic Medical Association. And today's webinar is entitled Improving Influenza Vaccination Rates for Hispanic Adults with Diabetes and Cardiovascular Disease during the COVID-19 pandemic. We're very fortunate to have two excellent and outstanding speakers who will complement each other and giving you some food for thought and I think some action steps to increase the vaccination rates among our community. And I just have to say, I did look up the latest figures from the Centers for Disease Control and Prevention, and Hispanics are really terribly vaccinated at about a rate of 37% over the last few years of data collection. You know, our goal is to have 100%. Everybody should be vaccinated for the flu because the flu virus has done so much in our communities to decrease productivity. Students can't go to school. You know, our workers can't go to work. Our families are devastated with when we get sick. Even if people think, oh, the flu is just a little cold, but honestly, people do get sick enough to be hospitalized. And I think we're learning with the COVID-19 pandemic, which is another virus that is a respiratory virus like the influenza, that it's much more contagious and lethal in our communities that just don't think about taking care of ourselves because we're so busy taking care of everybody else. So with that, let me just give you some housekeeping. We are going to have two presentations that will be about 15 minutes each. Everybody's microphones will be muted. Please, we encourage you to give us questions for the speakers. Any questions that come up as you hear their presentations, please put them in the chat box. I will moderate and provide the questions to our speakers after the two speakers talk. We are going to have a recording available on our website, which is nhmamd.org, next week. We encourage you to let others know who are not able to attend to please use our recording. And then just two big announcements. The National Hispanic Medical Association is proud to announce our foundation provides scholarships to students who have a commitment to Hispanic health care, who are leaders and outstanding academically. And we work with our sister organizations who actually do the review of medical students, nursing, public health, dental, pharmacy, and physician assistants. And that ceremony will be November 19, and there's a website there, or a URL, I should say. We also have a conference, one annual conference with quite a number of speakers addressing a variety of topics, including the flu vaccines and COVID. That'll be next March 17th through the 20th, 2021, and that will be our 24th annual conference. Next slide. So it gives me great pleasure to introduce our first speaker, Dr. David Kim from the Division of Vaccines in the Office of Infectious Disease and HIV/AIDS Policy at the U.S. Department of Health and Human Services, the Office of the Assistant Secretary for Health. David, if you'd like to just tell our staff, and I would like to thank our staff, Ben Milano especially, for next slides, and he will be moving the slides for you. Thank you very much.
Well, thank you for that kind introduction and the invitation for me to speak at this webinar, Dr. Rios. I appreciate the introductions, and we'll go ahead and get started. First, I need to explain that I have no conflict of interest, and that by design or by accident, if I mention specific trade names of vaccines, that they are for identification purposes only, and does not indicate that I or the agency is endorsing them. Next slide, please. So the burden of influenza. Let's look at the past season. 38 million flu cases, and that can range from anywhere between 30 and 60 million cases on an annual basis. And it's just incredible to me that we're talking about the entire population of California being infected with the influenza virus every year, and there are interventions available, and so I take great pride in having this opportunity to talk to you about those interventions. The 38 million cases translate to 400,000 hospitalizations due to the influenza infection and complications arising from the flu. And unfortunately, that resulted in 22,000 deaths back in the past flu season, and that's simply a travesty. So many of those deaths could have been prevented. Next slide, please. And economically speaking, in terms of direct medical costs, the burden of influenza results in $3.2 billion per year of cost to society. And when we take into consideration other economic burdens such as missed work and school and such, it translates to $11.2 billion on an annual basis. Now, with the news cycle, we throw around millions and billions and trillions pretty carelessly. Let me just put $11 billion in perspective. If I had $11 billion, I could give every man, woman, and child in Canada $300. That's how big that figure is. And if I had 11 billion frequent flyer miles, I could go back and forth. I would be able to take 23,000 round trips to the moon. So the burden of flu is great, not only in terms of healthcare costs, but also economically. Next slide, please. So just to talk about what goes into the flu vaccine for the current year, there are two A strains and one B strain, and for the quadrivalent vaccine, the flu vaccine, there is a fourth strain that's influenza B. So details are not necessarily that important, other than knowing that based on the recent trends, available strains, and various epidemiologic models, these strains typically for quadrivalent, two A strains and two B strains are considered and incorporated in early spring for production over the summer for distribution beginning in August and September. Next slide, please. And many people talk about the vaccine effectiveness, and so I want to share this with you to let you know what the trend has been like for vaccine effectiveness for against influenza. For the past year, 2019-2020, the vaccine effectiveness was calculated to be at 39%, which was far better than what it was the year before, which was 29%. And as you can see here, typically the range of vaccine effectiveness goes from about 30 to 60%. And before you say, well, that's not so great, vaccines, we should have 90, 95% vaccine effectiveness, if not 100%. Well, consider if you can prevent severe influenza illness 40% of the time, I would say that's a pretty darn good tool in your toolbox to use for yourself, your family, and for your patients to make sure that they're protected to the extent possible. Next slide, please. So the vaccination recommendation really hasn't changed very much over the past several years. And the primary recommendation is that all persons, children age 6 months and older, and all adults who do not have contraindications. Basically, that means you have severe allergic reaction to vaccine component. And the recommendation is to vaccinate by the end of October. So right now we should be in high gear for influenza vaccination efforts. And with the SARS coronavirus 2 co-circulating along with the influenza virus, and it's sure to become more pronounced in the coming weeks. It's particularly important that people get their influenza vaccination now. Next slide, please. So, who are our patients that we should be particularly paying particular attention to? Well, folks who are at risk for medical complications are the folks. That is young children, older adults, pregnant women, people with chronic diseases such as cardiovascular disease and diabetes that we're talking about, people who are immunocompromised, either because of the disease or the treatment for the disease, and people in chronic care facilities. Next slide, please. This slide is pretty heavy on details with data, but suffice to say that for people with cardiovascular disease, influenza vaccination every year is very, very, very important. For people with heart conditions, cardiovascular predisposition disease, then influenza vaccination can protect you from hospitalizations, severe disease, further additional cardiac events such as MI and congestive heart failure, stroke, and death. So I think I can distill this whole thing down into this box here, this blue box here that says benefits of annual flu vaccination is particularly pronounced for people with cardiovascular disease. It's somewhere around 20 to 30%, and that's on par with if you were to quit smoking, if you take cholesterol medicine every day, or you control your blood pressure with medications every day. So one shot every flu season is as good as doing these things. That's a pretty darn good case for people with heart disease to get the vaccine. And that's the reason why the American Heart Association and the American College of Cardiology have made their position statements that people with heart disease or people who are at risk for heart disease even should get the flu vaccine every year. Next slide, please. Okay, let's look at diabetes. What are the benefits? Well, diabetes is highly prevalent. 30 million adults in the United States have diabetes, and as such, they're at high risk for flu infection and flu complications. Getting the flu vaccine every year can prevent one from developing severe enough disease from influenza and influenza complications to reduce the rate of hospitalization by 79%. So we can prevent 4 out of 5 admissions to hospitals for people with diabetes who end up with influenza infection by simply giving them the flu vaccine. Next slide, please. As I indicated earlier, the vaccine effectiveness is not 100%. It's not, and it's not 80%, but it's somewhere around 40%. Okay, so even if you do get the vaccine, you can still get influenza infection. And thankfully, even if you do get the infection, your case will be milder, so that your risk for hospitalization is much less. But if you do end up getting sick with influenza, there are antiviral treatments, and the recommendation is that for people who are at higher risk, treatment should be recommended or ordered as soon as possible. Even if it's a suspicion, you can always pull back from the treatment, but you should not delay treatment with antivirals. And in other cases, you can consider impaired treatment based on your clinical judgment and your discussion with your patients. If you can get the antiviral into to the patient within 48 hours of symptom onset. Okay, there's a little caveat to this. The live attenuated influenza vaccine, LAIV4 as stated here, and that's the flu mist, should not be used if antivirals, oseltamivir and zanamivir, are used in the previous 48 hours because of the interaction between the vaccine preventing the body from expressing the antibody potential. And a couple of other licensed antivirals, peramivir and baloxavir, there's a caution that should be used when LAID, flu mist, is used with these antivirals because of their longer half-lives. Next slide, please. Okay, now let's talk specifically about race and ethnicity here. If you look at this this figure, the top blue line here, 54.8% represents the flu vaccine coverage for children and adults for non-Hispanic whites. So often non-Hispanic whites are used as a comparator group for other race and ethnicities. The black line there, 51.8%, that's everybody in total. So we can compare black non-Hispanics and Hispanics to everybody in total, or to the non-Hispanic whites. And unfortunately, about 47% vaccine coverage rate translates to what African Americans get and what Latinx get. That's pretty close to 10 percentage point reduction from what the non-Hispanic whites get. So clearly, there's work to do for all of us collectively. Next slide, please. So how can we deliver vaccines safely during the COVID-19 pandemic? I think the most important thing to remember is that, yes, there's a pandemic going on, but you can get the vaccine delivered to these patients safely because it is an essential medical service. Other things that can be considered are listed here. I'll just go over them very briefly. You need to assess the vaccination status of all patients at every opportunity, meaning every clinical visit. Administer routinely recommended vaccines whenever you're given the opportunity, meaning don't miss an opportunity to administer the flu vaccine. If someone if you're suspecting that someone might have COVID-19 based on their symptoms as well as exposure history, then you should delay vaccination for those people. Follow guidance to prevent the spread of COVID-19 in healthcare settings. It goes without saying. And there are other effective strategies for catch-up vaccination, such as reminder recall, standing orders, and other strategies that can be implemented to make vaccination a routine practice in your office setting or in healthcare systems. And communication is always a big deal, and the most important thing we can be doing. Next slide, please. So specific strategies to promote flu vaccine during in the time of COVID. We collectively as healthcare providers, we have to do what we preach. So every team member should get the flu shot. So you have one voice in the clinic, and you're all speaking from the same with the same language. And I might share with the audience here that a few years ago, I was talking to after a conference. I was talking to a provider who said that I had great flu vaccination coverage rates in my practice, upwards of 90%. And one year, after one season, that coverage went down to 60%, and I could not figure out why. And so as soon as I learned that, I talked to my staff about it, and did some digging, and it turns out that I had a medical assistant who came in the summer before, and she was not a fan of the flu vaccine, and just given her presence and her interaction with their patients, that resulted in 30% decrease in flu vaccination coverage rates in their office. That's how important this is. Of course, providers are what patients trust the most to get trusted information. So strong provider recommendation is an important strategy. Using presumptive versus participatory recommendation, that is saying something to the effect, today you're going to get the flu shot, roll up your sleeve, as opposed to, well, I want to talk to you about getting the flu vaccine. What do you think about the flu vaccine? So using presumptive recommendation, it has been proven to be an effective tool. Personalized recommendations, I'm going to cover this in the next slide. Other evidence-based practices, and I mentioned reminder recall and standing orders. Another important administrative tool that you have in your office is actually designating a champion in your office who advocates for vaccination, flu vaccine in this case. And also making the system, your patient flow, and make it conducive to talking about flu vaccine and making the recommendations and doing that on a routine basis. Okay, so some of the personalized recommendation. Next slide, please. I listed 3 of them here, and I'll just take the middle one here. It could be something like my dad or my uncle has diabetes, so I always make sure that he gets a flu shot every single year. So that way, even if he does get sick with the flu, I know that the flu shot will decrease his chance of going to the hospital by at least 50%. So personalizing it, presenting information that they can relate to, and obviously displaying the benefit of the flu shot is very, very effective. Okay, next slide, please. So bottom lines, flu is bad and vaccine is good. For people with diabetes or cardiovascular disease, flu is very bad and the vaccine is very good. And I just explained to you that there are disparities, particularly among African Americans and Hispanics, on the flu vaccination coverage rates compared to non-Hispanic whites. And I can't emphasize this enough that you really need to get your staff vaccinated against the flu every year. And there are procedures in place to routinely assess, recommend, and administer, or refer. Even if you don't have flu vaccines in your office, you can still refer them to other providers or the pharmacy to get their vaccine. And documentation is important, obviously. And when I say documentation, I'm talking about Immunization Information System that many of you may be aware of, IIS. That's the common name is Vaccine Registry. So these are state-based databases where you submit the data and you can inquire the vaccination status of the patients who are in the database so that you have the most current information. As I indicated, strong, presumptive, and personalized recommendations are effective, and that even during the time of COVID, vaccines can be administered and should be administered despite the pandemic, as long as we have adequate precautions in place. Okay, next slide, please. So this concludes my remarks. I'll turn it back over to Dr. Rios for the next speaker. Thanks very much for your time. Dr. Rios, I believe you're on mute.
Sorry about that. I was just saying, Dr. Kim, thank you very much for that. And I think it's very important for the providers in the audience and those who work in medical offices or hospitals or clinics to talk up the importance of the flu vaccine, especially now with flu season. We're in the middle of flu season. You still need a flu shot. up until what, April, I think is the end of flu season apparently. But you know, with COVID-19, it's just so important to talk about the importance of the connections here. And of course, with our communities with diabetes and heart disease, it's even more important. So now we have our second speaker, Dr. Diana Torres Burgos, who is a Hispanic healthcare advisor. She's been with the National Hispanic Health Foundation, and she's also been a fellow of our leadership programs with NHMA, and has been a public health leader in the public health departments of New York City and also in Michigan, in the Detroit suburbs. So Diana has a lot of experience with talking to the public and providers on educating them about the Latino, I'll just say the challenges of talking to Latino patients. So Diana, take it away. Thank you very much for being here.
Thank you, Dr. Rios. Hello, everyone. Before I start, I just want to say I have no conflicts of interest to disclose, but I'm very happy to be invited to speak to you today about flu vaccination and Latinos and how we can address their concerns. And so basically, I'll be talking about Latinos and flu vaccination rates, the barriers that they face, some of the misinformation and how you can address them, and what practice strategies you can use to help improve influenza vaccination rates among your Latino patients. Next slide, please. So as Dr. Kim mentioned, the CDC recommends an annual flu vaccine for everyone over the age of 6 months and older, in particular in stressing high-risk groups. And as he mentioned, those with underlying medical conditions, heart disease, asthma, diabetes, kidney disease, very young children, especially those under the age of 5, and seniors over the age of 65, pregnant women, and racial and ethnic minorities. And the reason for this is because they are at higher risk for hospitalization secondary to the flu. Next slide, please. When you look at influenza hospitalization rates by race and ethnicity, what you can see here in this graph through that's done by FluServeNet, which is a collaboration of the CDC with hospitals throughout the US, what you see here is that racial and ethnic minorities are at higher risk for hospitalizations. The highest are non-Hispanic Black at 68% per 100,000 population. Second are non-Hispanic American Indian and Alaskan Native at 47.5% per 100,000 population. And third are Latinos and Hispanics at 44 rate per 100,000 population, as compared to non-Hispanic white at 38.3% and non-Hispanic Asian and Pacific Islander at 32.1%. And why is that? When you start looking at the vaccination rates according to race and ethnicity, during the 2019-20 season, the overall estimate for adults over age 18 was about 48%. But when you break it down by race and ethnicity, what you find is that Hispanic and Latinos have the lowest rate of influenza vaccination rates in the season 2019 to 2020 at about 38%. This is the non-Hispanic Black is followed by at 41%, and the American Indian Alaskan Native at 42%. When you compare this to Asian at 52% and non-Hispanic white at 53%. So the racial ethnic minorities lag behind as compared to the Asian and non-Hispanic white in terms of influenza vaccination rates. And so the question is, next slide please, why is this? So there are a lot of barriers, and I'll just be going over some of them, but some barriers that are very specific to Latinos are the lack of healthcare coverage, which leads to lack of healthcare access. The fact that the vaccine cost, if they don't have healthcare coverage, is high. It costs about $40 per flu shot right now, and if you're trying to get your family vaccinated, that can be very expensive. Also, many are not able to take time off from work to get, flu shots. So, and they are not able to go into doctors' offices at inconvenient hours. So, this has been helped a little bit with pharmacies now being able to give immunizations, but again, cost becomes a big issue. language, limited English proficiency, not having language services within practices makes it difficult for Latinos to be able to communicate, to feel safe, and to understand really what this all means. And health literacy, there's a real lack of understanding of how vaccines work and vaccine efficacy and safety. And so it's very important to improve the health literacy of your patients in terms of understanding why it's important for to have the vaccine to prevent disease. There's some cultural health and belief practices, which I'll go into a little bit more detail later, which also can impact whether someone will get the vaccine or not. There is fear and lack of trust in the health systems out there, and so people don't participate in those systems for fear, particularly in current political climate and immunizations and ICE and all that. But there's also a big fear of COVID pandemic. We're in the middle of a big pandemic now. There's a fear of people just going to health systems or providers because they fear that they will catch COVID from going to these institutions or even frontline provider offices. There was an interesting study done in 2009 in Washington Heights, which is a predominantly Hispanic community, on how people decide whether they'll get the flu vaccine or not. And what was interesting is that over 25% indicated that they didn't get vaccinated because they didn't believe the flu was a very serious illness. About 11% believed the vaccine just didn't work. 10% cited they really didn't have the time to get the vaccine, and 11% did cite the cost of the vaccine. So again, a lot of these are barriers that are not new. They've been ongoing for a while, and we still need to be able to address them. Next slide, please. So before I get into sort of addressing myths and misinformation and misconceptions, I'd like to talk about some common Hispanic cultural themes that I think it's important for providers to be aware of so that they could better understand how to address and message what information that would resonate with their patients. Be aware, though, that the Latino population is a very heterogeneous group. And so a lot of these may vary based on the language that's spoken, on the immigration status. Are you a recent immigrant versus a third generation, acculturation, gender, country of origin, and level of health literacy. However, some of these are in some way sort of a thread that's found in a lot of Latino cultures. First and foremost is the issue of familismo, or family. Family is very important to Latinos. They're very high oriented towards family. Many families live together, such as multi-generational homes where you'll have, grandkids and grandparents and parents living in one home. Usually there's one or two people that are identified as a family health decision maker that people all go to when somebody gets ill. But in general, it's important to understand that family is very important, and therefore knowing this, having family-oriented messages is very important in the Latino population. Respect, very much people believe in respect based on age, sex, social position, status, and authority. And as health providers, they are given a high level of respect because they're seen as authority figures. So knowing this, it's important to know that as a provider, your recommendation is actually very, very important and will be taken seriously and increase the likelihood of immunizations because you are seen as that person that, as the authority person that is able to sort of let people know why this is important for you to get this the shot. Personalism, rather than institutional relationships, people like health providers to be warm and friendly and personal, sort of a informal professionalism, and they want to see that you take an active interest in their life, that you display mutual respect. So you don't call an elderly person, for instance, by their first name. They're Mr. or Mrs., Diaz, for instance, if that's their name, because that's sort of seen as the respect that you give to an elderly person. Also, very, very important is the issue of confianza, or building trust, and that is people need to feel that you have their well-being at heart, that you really want to help them to get better and to prevent disease. Underlying this, and this is true, I think, in the elderly generation, the older generation, and that is fatalism. And it's something you need to be aware of, because basically it's a feeling of lo que Dios diga, meaning whatever God decides. So it's sort of, people say, you know, I don't need to do anything because God will decide for me. You're powerless to change. It's an external locus of control. And this is something, the way some people feel, that basically, oh, I don't need to get the flu. If I get it, it's because that's what God wanted. And with that, next slide, please. So the most common myth that most, first of all, I want to say that a lot of these myths are not just specific to the Latino population. I think what's more specific is understanding how to address them that would resonate more with the Latino population, so that we can increase vaccinated. But the most common one that most of my colleagues and myself have heard, and also from family members, is I get the flu from the flu shot. It's very important to stress that you cannot get the flu from the flu shot. The flu shot is a killed or inactivated vaccine and cannot cause illness. And so that's very, very important to stress. There is a live vaccine that's weakened and cannot cause illness, and is only it's only given actually in healthy people, and not those that are immunocompromised or have certain health conditions. Also, many people misinterpret the side effects as the fact that they got the flu. So some side effects that some people may get are aches, pain, and mild fever, and they think, oh my gosh, I'm getting the flu from the shot, when it's actually just a vaccine side effect, and those usually resolve very quickly within 1 to 2 days. Also, people need to understand that it takes a while for the body to build immunity once they are vaccinated, approximately around 2 weeks. And so if people get exposed to flu prior to their immunity prior to getting their immunity, rather, they can potentially get the flu. And it's not really related to the flu shot. So these are things that one can, tell patients, and to sort of let them know, this is why we can't get the flu from the flu shot, and just have a better understanding of how it works. Next slide, please. I know people who got the shot and still got sick, and I don't believe it works. Well, this could be for a lot of reasons, and that is, did we have a good match in terms of the flu shot with the circulating flu viruses? Because sometimes we've had very good years where there's a good match, you can reduce the rate of visits from 40 to 60%, but some years there isn't as a good match, so you may have more problems with that. The fact that older people and those with chronic diseases develop less immunity than healthy young adults may be an issue. Again, we discussed a 2-week window in order to develop immunity. And the fact that there are different types of strains that are circulating in the community, and some of them are not included in the flu vaccine. As Dr. Kim mentioned, there are 2 A's and 1 B, or 2 B's in the quadrivalent. But if the strain that you were infected with is not part of those in the vaccine, then obviously that's an issue. And again, as Dr. Kim mentioned, it has been shown to be associated with reducing hospitalization among people with diabetes by 79% and chronic lung disease by 52%. Next one slide, please. Another myth is, I'm afraid the vaccine is going to give me serious side effects. I'm afraid I'm going to get paralyzed. And so this is a common theme. And one needs to stress that actually most individuals who get flu shots experience no or very minor side effects following a flu shot. Usually some minor ones include, soreness or redness at the site of injection. That can last 1 to 2 days. They may also get some fever, aches, and fatigue. Again, those usually resolve within 1 to 2 days. Severe reactions are actually very rare. According to the CDC, a severe allergic reaction is estimated at less than 1 in a million doses. Guillain-Barré, which a lot of people bring up, is actually very rare. And people don't realize that you're actually more likely to get Guillain-Barré from having the flu illness than actually from the vaccine. Next slide. I don't need the vaccine, I'm healthy. No one can ever predict who's going to get sick, and vaccine offers you the best protections. And there are still cases of healthy people who really do get seriously ill and wind up in the hospital or even die. And so it's important to get it to protect yourself and your family. Next slide. I don't need it, I already got the flu. Many people feel that they got the flu and they may just have gotten a very bad cold or an influenza-like illness. There are a lot of viruses out there, such as respiratory syncytial virus, rhinovirus, adenovirus, and parainfluenza virus that can simulate the symptoms of flu. So even if people think they have the flu, unless it's been documented through testing, you should still go ahead and vaccinate with the flu vaccine. Next slide. Oh, it's not serious, it's just a bad cold. And as Dr. Kim has mentioned, it can be a very serious disease, particularly among young children, older adults, and those with chronic diseases. Therefore, still vaccination is the best protection we have in reducing flu-associated hospitalizations and death. Next slide. It's too late to get the flu vaccine. It's always better to get it before it starts. However, it's never too late. The flu virus continues to circulate in our community after peak season. It usually goes up to April, even sometimes May. So it's still important to get flu vaccinations. Next slide, please. So right now we're in the middle of a COVID-19 pandemic. So it's more important than ever to really get an influenza vaccine, because you can get both infections, and we've already had cases of this in the United States. However, there's no evidence that getting a flu shot is going to increase your risk of getting sick from coronavirus like COVID. And the CDC continues to recommend flu vaccination, especially for essential workers, people that are increased risk for severe illness, and those that are high risk for influenza complications, as we mentioned previously. Next slide. So what can you do in your practices to improve influenza vaccination rates around Latinos? First and foremost, recommend the vaccine. I had a family member status post heart surgery during primary, and whose cardiologist never mentioned the flu vaccine. It's very, very important that you recommended, you're seen as an authority figure, and you by recommendation will increase the likelihood of that individual getting vaccinated. Office reminders, EMR alerts, send out cell texts, phone calls, avoid missed office opportunities, have standing orders, provide educational materials within your office. Very important, staff education and training. You need to have your staff on board. When I was the medical director of a health department, was very surprised to find out that I had people working there that did not believe in vaccines at all. And so we had to do some training and education in terms of what the importance of vaccines were, their efficacy, their safety, and the fact that the mission of the public health department was to vaccinate and prevent disease. Offer convenient office hours, again, improve health literacy, provide language services. If you do not provide vaccines in your office, be aware of the community resources where you can refer people for low cost or no cost vaccines, such as departments of health, public hospitals. Have staff members that are reflective of your community, of your practice within the community. And most importantly, build trust. People need to feel safe. People need to know that you have their well-being at heart, and that will increase the likelihood of being, effective in your messaging and the importance of receiving a flu vaccine. Next slide, please. So in summary, some key recommendations for Latinos is use family-oriented messages. Best way to protect yourself and your whole family is to get vaccinated. Really address all those misconceptions and information. Explain the side effects and how it works. Vaccine protects both healthy and high-risk groups. Please make your patients know their risk. A lot of people don't know that being a diabetic puts you at a higher risk for flu-associated complications. And lastly, recommend the vaccine. As I mentioned, you will increase the likelihood of patients getting vaccinated and streamline your office and implement strategies that makes it easier for your patients to get the flu shot. And next slide. And for those who are interested, there's a great little vaccine handbook, a practical guide for clinicians that has a lot of tips and also goes over all questions regarding vaccines. That if you're interested, there are these other resources and that link's available to you. And with that, I thank you and pass it back to Dr. Rios.
Okay, let me just look at some of the questions. Let me just thank the speakers one more time. It was great to hear both of your presentations. Dr. Kim from the Department of Health and Human Services, Assistant Secretary of Health, and Diana Torres Burgos, Healthcare Consultant. There are a few questions that I'm going to go ahead and ask. And let me just remind everyone, if you have a question, please write it in the chat box at the bottom of your screen, and we'll get to as many as we can. If we can't get to all of them, we will send emails to our speakers and they can email you back. And we will capture the recordings and the slides that will be on our website, www.nhmamd.org, next week. So I know there's one question that already got answered by Dr. Kim. I'm just going to go ahead and tell everyone there was a question on the pricing of these medications versus the flu shot. And Dr. Kim, you want to tell everyone what you put in the chat box?
Sure, thank you. And I appreciate the question that was posed. And I believe the intent of the question is to see whether flu shot is worth getting in comparison to what would happen if you end up with the flu and you need medical attention and treatment. So oseltamivir is a prescription antiviral that can be used to treat influenza infection if the infection is detected early. And it's available as an oral form or IV. And obviously, oral form is used as an outpatient basis, and it's an expensive drug. All antivirals are expensive, and the newer, longer-acting antivirals are particularly expensive, and they're typically not available as an outpatient on an outpatient basis. But also Tamiflu or Tamiflu, which is what we know it as, is, even though it may be widely available through your healthcare provider, it just simply does not compare as far as effectiveness is concerned in dealing with the flu. So the cost of a flu shot is somewhere around $15 to $40, and in most instances, in many instances, as long if you have some sort of healthcare coverage, flu vaccines are covered. It's mandated to be covered. So even $15, even if you have to pay out of pocket $15 to $40 compared to a couple $100, there's just no comparison. And also Tamiflu, you just can't get that without seeing a doctor, and so there's that doctor's visit that's associated with it. So as far as comparing economics, flu vaccine, washing hands, taking care of yourself and others, personal hygiene, things like that. They're easy, effective, and long-lasting for the entire season. And I believe there was another question, as long as I'm talking about this, about the duration of the flu vaccine coverage or effectiveness. And yes, the immunity wanes over time, but the recommendation, and there is currently no recommendation to have a booster dose, let's say towards the end of the flu season. Right now, the recommendation is to get your flu shot early, before the uptake of flu in the community, so that you have 2-3 weeks to build up your immunity. And so the timing is, as I mentioned earlier, get your flu shot by the end of October. So the Boo to the Flu was a campaign to say, by Halloween, you should have your flu shot on board.
Okay, boo with the flu. Great. Okay, Diana, let me ask you about Latinos and the flu vaccine. You covered a lot of myths. There was a question on, do you think there's one that stands out as being really, really important for those who take care of Latinos? What would you say?
I would say, I mean, right now there's one going on about the COVID-19 vaccine that many say they will not take the vaccine because they feel that a chip has been put in the vaccine and the chip is meant to make them ill and die. And this has been said in the community. And so I think, is it, you know, uniquely Latino, I mean, every population thinks a little different, but I think the realization is there is this thought that there's something in there, there's the government wants us to get vaccinated because they want to control, they want to make us sick in some way. And so it's really something you need to be aware of and address. But again, I think for COVID-19, it's really going to be an uphill battle because a lot of people do feel with the fear and the political environment that this vaccine is going to be out there to hurt them in some way. So that's, I would say, uniquely what I find in the Latino population, but a lot of them are very similar. It's just, you know, understanding.
Okay, well, it's important to address the importance of getting the flu vaccine, the costs and benefits, and educate people more and more about the vaccine. Dr. Kim, a question about the effectiveness of the vaccine effectiveness, and has it fallen, or why has it fallen since 2013? And a similar question for you about the difference in the flu vaccine rates among the racial ethnic minorities, and the fact that it's gotten a little better despite our barriers in our communities not changing. I mean, you know, we still are uninsured. We still have, we're working 2 jobs. Our community doesn't have time to take care of themselves. They take care of everybody else. You know, the lack of education, lack of even just going to a provider to hear preventive information. So there's so many barriers that Latinos and African Americans, Asians, Native Americans that are more in our communities. You know, we need to know, why do you think that there have been some changes? There have some positive changes.
Let me address the first question first.
Or negative change, I guess, for the first one.
So the first question has to do with vaccine effectiveness. And just like the flu season overall, when you've seen one flu season, you've seen one flu season. So every flu season is different. And vaccine effectiveness, while since 2014 or so, you might have noticed that there's a bit of a trend, but there really isn't a trend. It's just that the vaccine effectiveness ranges over time, and it depends on what you put in, which strain you put in into the vaccine, and how people take the vaccine. So there are many, many variables, and I do not believe there is a particular trend. It's just that there's a range of vaccine effectiveness that typically you calculated at the end of each season. On the question of racial and ethnic disparity, this is a task. It's a major task, and it is something that all of us in public health are aware of and are trying to address. Sometimes successfully, other times it's just hard. And Dr. Torres Burgos that just mentioned that there are multiple reasons why this is the case, and for every race, for every ethnicity, and even within communities of the same ethnic belonging, there are different beliefs and uptake of vaccines. So it is a challenge. There is no simple answer. But as far as what I think a question was posted in the chat box, why is the disparity this past season so much wider than the years before? But if we look at the graph again, or look at the figure again, then we notice that that for racial and ethnic minorities, one thing is consistent, and that's the coverage rate is is lower, basically across the board every year compared to non-Hispanic whites. For this past season, for some reason, the rate for non-Hispanic whites went up significantly higher than other ethnic groups, race and ethnic groups. So that accounts for the difference. But the actual uptake by Hispanics, unfortunately, are about the same. So is that a trend? No, of course not. It's one data point. But is there something we can take from that? We need to look into it more. But I'm afraid that the data itself is one big conglomeration, and probably not useful to ask these pointed questions. But I think the lesson is that there is disparity, and the disparity is something that we should all be working on. That Dr. Torres mentioned.
Okay. Do either of you know? There's a couple of questions more focused on Hispanic uptake and access. One is because Hispanics don't have insurance, are there programs for the uninsured to help with the vaccines, to help get the flu shot, pay for the flu shot, educate more people about the flu shot? Diana, do you want to talk about the importance of from a public health perspective of getting to our communities?
I think it's very, very important to know what your resources are in your communities. Many people don't realize that you can go and get a lot of your immunizations free at public health departments or at public hospitals. They also have places where you have very low cost. So it's really dependent on your community and what your resources are. One thing I would, I've always recommended for providers is really have a list of what the resources are for your patients, such that if one comes in and they need stuff and you're not able to provide it, they know who to refer to. The other thing is some practices are now, forming teams, and I think teams are very important, where you have community health workers who come from the community and actually know resources and can also help in that sense, promotoras, as they say, and that's very important. And then the other thing is that I think the issue of access is always a problem, and I wanted to stress and bring up the issues of all these barriers and economic barriers. The social determinants, as we call them, they're still there. We're still battling it, and it's still a long ways off from getting anywhere to equality. But we need to really understand that we need to partner with certain resources within our community where we can actually offer low cost or no cost vaccines. And so that is really getting more of the pharmacies involved, because some families can't afford one shot at $40. So is there something that we can do as a collective community to partner or providers? So yeah, there are resources. They differ across communities, but there are particularly health departments and public health hospitals.
And let me just ask Diana if you've seen any research studies on the importance of community health workers or promotoras with the flu vaccine. Any programs, any studies?
There are multiple studies, and they all say exactly the same thing. Having promotoras in your office increases your likelihood of vaccination, adherence, and everything else. So I think that is a very important asset to have within one's practice.
Okay, one last question. I know we're running out of time, and I apologize again to everybody, but to Dr. Kim, you mentioned the different types of antiviral, I shouldn't say antivirals, but the vaccinations themselves being trivalent versus quadrivalent. I mean, could you explain the difference?
Oh, sure. Thanks for that question. There are different categories, different types of flu vaccine. And the vaccine, the flu shot versus the flu mist, and even within the flu shot, you have the inactivated vaccine, you have recombinant vaccine, you also have cell culture-based vaccine, and so on. And this has gotten some attention over the past several years. The high-dose influenza vaccine, and the high-dose influenza vaccine contains 4 times the antigen as a standard dose flu vaccine, and because of that, it renders higher protection that's published in the literature. However, the recommendation is simply get whatever flu vaccine that's available when it's available to you. So don't miss an opportunity. Don't wait for high dose vaccine for your 70-year-old grandmother or 65-year-old uncle. Whatever is in the clinic available at the time, get the vaccine. Just simply get the vaccine. As far as addressing the trivalent versus quadrivalent, quadrivalent simply has one more type B strain than the trivalent, and it adds an added benefit. But studies have proven that they don't that they're not necessarily the trivalent versus quadrivalent. The vaccine coverage or vaccine effectiveness do not vary significantly. So again, the idea is as soon as a flu vaccine becomes available and there's an opportunity, make sure that the vaccine gets administered to the patients.
Okay, well, great. Well, thank you to both of you, Dr. Kim from HHS, Dr. Torres Burgos from New York City. And I want to thank everyone. The NHMA will have this recording on our website at www.nhmamd.org next week. And in terms of upcoming events, again, we have our scholarship ceremony. We are presenting some awards to some key leaders around the country to provide inspirational events. And one of the leaders is including the Surgeon General, Dr. Adams. So we're very happy to honor him for his work, especially this year with the COVID vaccines. And we also have somebody from the heart disease world, and that is Dr. Eduardo Sanchez, who is with the American Heart Association, and a couple of doctors who have been on the front lines in COVID, recommended by our boards of directors from New York City and from Los Angeles, and also the president of the Hispanics in Philanthropy. So that'll be important. And also on December 1st, we have a webinar on HIV and COVID-19 in the Hispanic LGBTQ community. And December 8th, we have a Twitter chat on tackling the flu season during COVID-19. And on December 10th, we have NHMA All of Us research program fireside chat on older adults and the importance of reaching them and enrolling them in this new research program for NIH. And again, our national conference, and I might add, we are looking for speakers for our conference. You can go to our website at nhmamd.org and see the draft agenda that we have. We're also looking for poster presenters. And I just might add, for those of you in academics, it's important to consider speaking at national conferences because you get points in your promotions. And for those of you in practice or those of you in public health, we have a lot of speakers who address issues that are important to your advancing your businesses and your careers. It is probably one of the few national conferences that deal specifically with Hispanic health in terms of issues and strategies. And we are very much going to be focused on COVID-19 next March, and it'll be a virtual meeting, but we are asking people to register for some slight fees for that. So thank you very much for participating. And thank you again, Dr. Kim and Dr. Torres Burgos, and to the NHMA staff, to Ben Milano, thank you very much, and Vince Garrity. Thank you.
Thank you.
Okay, bye.
Bye-bye.